Hello, I am Thor-Bjørn Ottosen, specialist in the Center for Air and Sensor Technology at the Danish Technological Institute. And today I will give a short introduction to the concept of perceived air pollution. In this presentation, I will cover what is perceived air pollution, why do we as air quality professionals need to pay attention to perceived air pollution, and lastly, to introduce the concept of perceived air pollution as it is understood in the literature today. First, a bit of terminology. In the literature, perceived air pollution is basically a subtopic of a larger topic, which is perceived environmental risk. This is the risk of other environmental hazards than air pollution, which is again a subtopic of the overall topic of perceived risk. So when we talk about perceived air pollution, we can understand it as a subtopic of the concept of perceived risk. Perceived risk is defined as people's beliefs, attitudes, judgments and feelings, as well as the wider cultural and social dispositions they adopt towards hazards. That's one definition, naturally. If we look at the elements of this definition, then the first element to notice is people. Who are the people we're talking about? Is that the population of a country? Is that the population of a specific city? Or the population of a specific neighborhood or other group of people who share particular characteristics? Before we start talking about perceived air pollution, we need to discuss perceived by who. The next thing to notice in this definition is that it has to do with beliefs, attitudes, judgments, and feelings. These are individual traits that have to do with the individual person who perceives air pollution one way or the other. So individual traits that can be age, that can be education, that can be ethnicity, will influence people's perception of air pollution. And the last thing to notice is the cultural and social dispositions, which means that the society that people are living in will also influence their perception of air pollution. This can be seen, for instance, in different perceptions between developed and developing countries, as an example. The hazard we're talking about here is naturally the hazard of getting ill from breathing polluted air. And this is also the risk that people are running, the risk that people are perceiving in this particular setting. Why do we need to pay attention to perceived air pollution? Well, first of all, because it's interesting. Second of all, because if the perceived air pollution is higher than the actual air pollution, it means that the population perceives that they're being exposed to air pollution even though they're not. It leads to negative psychosocial health. This can be, for instance, stress, because it's stressful to believe that you are breathing polluted air. In the other situation, if the perceived air pollution is lower than the actual air pollution, it leads to negative effects on physical health, because it means that the people we're talking about, they're not taking appropriate precautions towards this hazard of breathing polluted air. We also need to pay attention if we wish to improve public health through health behavior. That can, for instance, be influence on sources, such as limiting the individual's contribution to pollution. That can be limiting the individual car use or use of wood stoves, or influence on the receptors, the people that breathe the polluted air, through, for instance, environmental friendly planning of choice of routes, or air purification of various kinds, or other means. And lastly, if we want to create public support for policy measures to aimed at reducing air pollution, we need to pay attention to people's perception of air pollution, not just the actual levels of air pollution. So, what do we know about perceived air pollution? In its most simplified version, we talk about lay people as opposed to experts. We know that air pollution perceptions for lay people, they are formed by a number of factors that can be vision. Can you see air pollution? Sometimes you can if you have a smog event, for instance. It can be the smell. Sometimes you can smell air pollution. It can be nearness to sources of air pollution, such as industrial facilities. It can be vegetation. Is the area that we're talking about, is that a green area or a gray area, will influence your perception of air pollution. It also has to do with physiological effects. If people are having asthma or other types of breathing problems, they can sometimes feel in their lungs that the air pollution is high, and this influences their perception of air pollution. And lastly, it has to do with neighborhood commitment. If you are very committed to your neighborhood, if you think your neighborhood is a nice place to be, you will naturally tend to think that the air pollution is low. On the other hand, if you are not committed to your neighborhood, if you do not like to live there, you will tend to think that air pollution is just one among a number of factors which makes the area less attractive to live in. Experts, on the other hand, form their perceptions based on lab experiments, calculations, models, monitoring, but also on collegial relations, meaning that experts will influence each other on their perceived air pollution of a specific area. So this is the most simplified version of how perceptions of air pollution are formed. If we look at it a little bit more in detail, perception is not just one thing. Perception can be divided into a number of sub-elements. The first thing is perception of the exposure. This means, do you perceive that you are actually breathing polluted air? The first element in this is then definition and identification of a hazard. Is air pollution actually something that can influence your health? Some people perceive that, some people do not perceive that. The next step is perception of the degree of exposure to the identified hazard. So, once we have perceived that air pollution is actually dangerous, do you then perceive that you are actually breathing air pollution or don't? And then the next step is then perception of the effect of the exposure. Do you perceive that even though you breathe polluted air, will it actually influence your health? It can be perception on the health impact of the hazard, and it can be the concern about the health impact of the hazard. First of all, will it actually influence you? Some people will say, I have a strong health, I don't need to worry about air pollution. And second of all, even though we do worry about air pollution, is this something that we should be concerned about? Or are there other elements in our lives that are more important, higher on our list of priorities compared to air pollution? And all these elements are required if we want to achieve health behaviors, such as mitigation behaviors, environmental activism, protective behaviors that was listed on the slide before. And all of these are influenced by social, economical, and political context that the people are living in. So, as a conclusion, perceived air pollution differs between different groups of lay people. It's very important to consider who are the people, who are the group of people that we are thinking about here. And also that air pollution perception changes over time. It's not a static concept. This was all I had decided to present for today. If you want to know more about perceived air pollution or other air pollution topics, you are welcome to contact me on this email or phone number.